videos, it's not published yet, of where these people started, all of his lifestyle changes, meditation, dietary change, breathing changes, enjoyment of life. And literally it made me cry. Some of these people, they couldn't come up with a word or a phrase, and then they're talking perfectly a few months later. So he's really doing an amazing job. So first, a quick little video to introduce you to Dr. Dean Ornish. Here we go.
Everywhere you look, it seems a heart attack is just waiting to happen. More than 1 million heart attacks a year.
A new report from the Centers for Disease Control and Prevention says 200,000 deaths from heart disease and stroke could be avoided each year.
This man is one of my heroes. I have been following him since I was a resident. He is the very doctor who turned the medical community on its ear with his groundbreaking findings on the heart.
For over 35 years, Dr. Dean Ornish has conducted scientific research studies that have empowered the way millions of people think about their daily lifestyle choices in relation to their health and well-being.
What I'm most passionate about and what I find most interesting is how we can use the experience of suffering as a doorway for transforming our lives and finding meaning. And then we can often get curing, but we can always get healing.
Author of 6 New York Times best-selling books, Dr. Ornish is responsible for developing the first scientific program proven to reverse heart disease by addressing its root causes. He was even appointed by President Obama to head the White House Advisory Group on Prevention, Health Promotion, and Integrative and Public Health.
Ladies and gentlemen, he's going to give us a presentation. Give it for a dear friend, Dr. Dean Ornish. Give it up for him. Whoa! Take it away, Dr. Dean.
Hi, I'm Dr. Dean Ornish, and it's my great pleasure to be here today with my longtime friends, Tony Robbins, Peter Diamandis, and others at the Life Force Summit. Thank you for the chance to be here today. I'm going to talk about the power of lifestyle medicine. And lifestyle medicine is a field that I helped create. I'm known as the father of lifestyle medicine, which uses lifestyle changes not only to help prevent disease, which we all know, but to treat and often even reverse it. And for the last 44 years, I've directed a series of clinical trials showing how powerful these simple changes are and how quickly people can feel better and are better in ways that we can measure. You know, people often think, oh, diet and lifestyle, that's kind of boring. It has to be something really high-tech and expensive to be powerful, a new drug, a new laser, a new device. And yet what we've been able to show, ironically, is using these very high-tech, expensive, state-of-the-art scientific measures to prove how powerful these very simple and low-tech and low-cost interventions can be. And we found these same lifestyle changes could reverse a wide variety of the most common and chronic and costly diseases. And these simple changes are a whole foods plant-based diet that's low in fat and sugar, moderate exercise, both aerobic and strength training, stress management techniques including meditation, and social support. Or to reduce it even further, you know, one of my favorite quotes is from Albert Einstein. He said, if you can't explain it simply, you don't understand it well enough, is to eat well, move more, stress less, and love more. Boom, that's it. And the more diseases we study, the more scientific evidence we have to show what a powerful difference these simple changes can make and how quickly you can feel better in ways that really matter most. You know, a panel of nutrition experts from U.S. News and World Report rates diets every year, and for the last 11 years since 2011, they've rated what they call the Ornish diet as #1 for heart health, including for this year, which I appreciate. And what differentiates my work from all others is that it's based on 4 decades of research published in the leading scientific and medical journals, showing how these simple changes can often reverse the most common and costly chronic diseases, as I mentioned. These include things like coronary heart disease, type 2 diabetes, high blood pressure, high cholesterol, early stage prostate cancer, obesity. When you change your lifestyle, it changes your genes, turn on the good genes that keep us healthy, turns off the ones that cause us to get sick, lengthen telomeres, and reverse aging at a cellular level in ways I'll talk about more later. And it wasn't one set of diet and lifestyle changes for heart disease, a different one for prostate cancer, a different one for diabetes. It was the same for all of them. And so I wondered, why is that? And I realized that because they're really not so different. You know, I was trained, like all doctors, to view heart disease, diabetes, prostate, breast, colon cancer, etc., as being fundamentally different diseases, different diagnoses, and different treatments. But I really think that they all are in many ways the same disease, manifesting and masquerading in different forms, because they all share the same underlying biological mechanisms. I wrote a book called Undo It with my wife and partner of 26 years, Ann Ornish, that I was really happy made it to all the bestseller lists. And it puts forth this unifying theory that the reason why these same lifestyle changes can reverse all these different chronic diseases is because they all share the same underlying biological mechanisms. Things like chronic inflammation, changes in the microbiome, the 100 trillion cells that live in our gut, changes in angiogenesis and apoptosis, and overstimulation of the sympathetic nervous system during times of chronic stress, changes in immune function and so on, in telomeres and gene expression and so on. And each one of these biological mechanisms in turn is directly influenced by what we eat, how we respond to stress, how much exercise we get, and how much love and support we have. And it also helps explain why you'll find the same patient will have many of the same conditions. They'll often have high blood pressure, high cholesterol, heart disease, diabetes, being overweight, and so on. Because, it's the same cause manifesting in all these different forms. And the reason that I've spent so much of my life doing these scientific research studies is because it can help raise awareness. And to me, awareness is really the first step in healing. When you understand what a powerful difference these changes can make and how quickly they can occur, hopefully that will motivate you to begin making them. And then once you do them and you start to feel so much better so quickly, it reframes the reason for changing your lifestyle from fear of dying, which is not sustainable, to joy and pleasure and love and feeling good, which are. Because there's no point in giving up something that you enjoy unless you get something back that's better and quickly. And when you make big changes all at once, it's actually paradoxically easier than just changing one thing, because when you change a lot of things at the same time, you feel so much better in ways that really matter. Your brain gets more blood, you think more clearly, you have more energy, you need less sleep, you can grow so many new brain neurons through a process called neurogenesis. Your brain can actually get measurably bigger in just a couple of months. Your skin gets more blood, so you look 10 or 20 years younger. I'm 99, I look, no, just kidding, look pretty good, but I'm actually 68, almost 69. Your chest gets more blood, your heart gets more blood, you can reverse heart disease, your sexual organs get more blood in the same way that Viagra works. And so for many people, who can't walk across the street without getting chest pain, or make love with their spouse, or play with their kids, or go back to work without getting chest pain, and often in a few weeks they can do all those things, then they say things like, well, I like eating junk food, but not that much, because I feel what I gain is so much more than what I give up. That makes it sustainable. The underlying ethos of all the work that we do is to treat the cause instead of literally or figuratively bypassing it. Sometimes when I lecture, I'll show a cartoon of doctors busily mopping up the floor around a sink that's overflowing, but nobody's reaching over to turn off the faucet. And what we're learning is that when we can turn off the faucet, when we can change our lifestyle to treat the cause, that our bodies often have this remarkable capacity to begin healing, and much more quickly than we had once thought possible. And everything that I'm going to share with you in this talk was thought impossible at the time. And the reason that research can be so powerful is we can redefine what's possible in many cases. And when we can do that, we can give millions of people new hope and new choices they didn't have before. So we started back in 1977, 45 years ago, when I was a medical student, and we found for the first time that we could actually reverse heart disease. At that time, it was thought once you had it, the best you could do would be to slow down the rate at which you got worse. But what we found is like ounce of prevention, pound of cure. It's hard to reverse a chronic disease. It requires much bigger changes than a lot of things at the same time. But if you're willing to do so, we found, for example, that the arteries that feed the heart got less clogged after 1 year, and even less clogged after 5 years, whereas the normal rate was to get worse and worse. We found that most people became pain-free. There was a 91% reduction in the frequency of chest pain, and we measured a 400% improvement in blood flow to the heart by PET scan, and 99% of the patients in this study stopped to reverse the progression of their heart disease, whereas only 5% of the usual care control group patients got better. And they had 2.5 times as many heart attacks, strokes, bypasses, angioplasties, stents, and so on in the usual care group than in the one that made these lifestyle changes. But to put a human face on this, We have a number of patients who had such bad heart disease, they were told that the only thing that could save their life would be to have a new heart, a heart transplant. And this is one guy I'm going to show you. It's only a minute and a half long interview, who's an internal medicine doctor himself and was told that he needed to have a new heart. And while waiting to find a donor, people don't like to give up their hearts. You have to find someone who was killed in a motorcycle usually to donate their heart. He went through my reversing heart disease program at UCLA to get in better shape for the heart transplant. But his heart improved so much during those 9 weeks that he didn't need a heart transplant anymore. It's kind of the ultimate high-tech, low-tech juxtaposition. Like, what's the more radical intervention here? Getting your chest cut open and having a new heart put in? Or eat well, move more, stress less, and love more? So let me play this for you now.
So the situation I'm describing here is of an internal medicine doctor who started a new chapter in his life with his wife, moving to Lake Arrowhead, having just opened a private practice office after all of our kids went to college and we could relocate. And just as this was ramping up, we had a horrible car accident which precipitated a heart attack that dropped my cardiac functioning down to basically 11 to 13 or 14, 15% of what it should have been, which resulted in intractable chest pain, angina, trouble breathing, inability to walk from room to room, go upstairs without being carried. I was offered a heart transplant as the only way to stay alive. And at the 11th hour, I entered the Ornish program, which provided me with an entire paradigm shift with respect to stress management, exercise, diet, nutrition, and despite not believing it myself and having other physicians who didn't believe in it either, it worked beyond my wildest dreams. I'm now able to exercise moderately. I can work full-time. I can live at 6,000 feet. And our quality of life is actually better than it was before.
I'll even let him take my lipstick off.
Can you believe this is my wife?
We then found that these same lifestyle changes can stop or reverse the progression of men who had early-stage prostate cancer, which is one of the most common cancers in men. We did that in collaboration with the chair of urology at Sloan Kettering, Bill Fair at the time, and Peter Carroll when he was chair of urology at UCSF, where I'm a professor. And we found that the PSA levels, a marker for prostate cancer, got worse in the control group, got better in the group that made these changes, in direct proportion to the degree of lifestyle change. Just like we found in our cardiac program, that the more people changed, the more they improved in terms of the arteries getting less clogged or the blood flow to the heart improving. When we added their serum to a standard line of prostate tumor cells growing in tissue culture, we found the tumor growth was inhibited 70% versus only 9% in the control group, also in direct proportion to the degree of lifestyle change. And none of the experimental group patients who made these lifestyle changes needed surgery or radiation, but 6 of the control group patients did. And then in another study, we found these same lifestyle changes could reverse type 2 diabetes. And type 2 diabetes, half of the population today in the U.S. and in much of the world is diabetic or pre-diabetic. And getting your blood sugar down with drugs doesn't help prevent the horrible complications of diabetes, blindness and amputations and heart attacks and impotence and strokes and so on, nearly as well as getting it down with diet and lifestyle. And when people are put on drugs to lower their blood sugar or their blood pressure or their cholesterol level, and they say, "Doctor, how long do I have to take these drugs?" What does the doctor usually say? Forever. It's like, how long do I have to mop up the floor around the sink that's overflowing? Like, forever. Well, why don't we turn off the faucet? And again, many people, if you're put on these medications, don't change them without your doctor. But in many cases, your doctor will be able to reduce, or in some cases, get you off these medications forever that you were told you'd have to take for the rest of your life. We're also in the middle now of doing the first randomized trial to see whether these same lifestyle changes might stop or reverse the progression of men and women who have early-stage Alzheimer's disease. My mom died of Alzheimer's, and it was tragic seeing her beautiful mind deteriorating. And I think we're at a place with Alzheimer's very reminiscent of where we were with heart disease 44 years ago. In other words, what's good for your heart is good for your brain, and vice versa. We know back then it was thought the best you could do would be to slow down the rate at which heart disease got worse. We found bigger changes could stop or reverse it. Again, ounce of prevention, pound of cure. we know that less intensive lifestyle changes can slow the rate at which you get worse with Alzheimer's. My hypothesis is that maybe more intensive ones might stop or reverse it. And that would be especially important with Alzheimer's because at least with heart disease and other conditions, some things, work, at least to some degree, but nothing really works with Alzheimer's. There have been over 200 drug trials in the last 20 years. They've spent billions and billions of dollars. They've all failed. The only drug that's even been approved in the last 20 years was called aducanumab last year, and there was a lot of controversy around that because it turned out that one study showed it did nothing, the other study showed at best it slows down the rate at which you get worse, and it's like $56,000 per dose. So we're hopeful that we might be able to show that if we make bigger changes with people who have early stage Alzheimer's, that perhaps we can slow, stop, and maybe even reverse it. So stay tuned. I'm cautiously optimistic. And also people often say things like, I've just got bad genes, there's nothing I can do about it. It turns out that you actually can do a lot about it, that our genes are a predisposition, but our genes are not our fate. And we did a study with Craig Venter, who was the first to decode the human genome, and we found that when you change your lifestyle, over 500 genes were changed. And in fact, turning on the genes that keep us healthy, turning off the ones that cause us to get sick, and particularly down-regulating the genes that cause these mechanisms that are common to all these different chronic diseases that I mentioned earlier, chronic inflammation, oxidative stress, and so on. And we found we particularly down-regulated or turned off the genes that promote prostate, breast, and colon cancer, which are the most common cancers. So again, our genes are not our fate. We then did a study with Dr. Elizabeth Blackburn, who got the Nobel Prize for discovering what are called telomeres. And telomeres are the ends of our chromosomes that regulate how long we live. They're sometimes likened to the plastic tips on the end of a shoelace that keep your shoelace from unraveling. They keep our DNA from unraveling. And when DNA replicates, over time the telomeres get shorter. And as our telomeres get shorter, our lives get shorter. And the risk of premature death from all these different conditions we've been talking about, including Alzheimer's, goes up proportional to the shortening of the telomeres. And she had done some amazing studies with Alyssa Epple and others that people who, like women who are under chronic emotional stress, their telomeres got shorter faster, or eating junk food, or smoking cigarettes, or being sedentary, or being under, a lot of social isolation, make your telomeres get shorter faster. And so we met once and I said, if bad things make your telomeres shorter, maybe good things make them longer. Most things in biology go both ways. And we found, sure enough, that after just 3 months, the telomerase, the enzyme that repairs and lengthens telomeres, increased by 30%. And over a 5-year period, we found the telomeres actually got longer by 10%, whereas they got shorter in the control group, which is what usually happens. This was the first study showing that anything could actually lengthen telomeres. I mean, if this was a new drug, it'd be $1 billion drug. And when we published this, the Lancet editors sent out a press release calling it first study showing that lifestyle changes may reverse aging at a cellular level. And as I get older, that has a lot more appeal to me than it maybe once did. And here again, we found that the more people change their lifestyle, the longer their telomeres got. And so, what enables us to make sustainable changes in our lives, as I mentioned, is that you feel so much better so quickly. It's not all or nothing. If you're just trying to, lose a few pounds, get your cholesterol or blood pressure or blood sugar down a few points, whatever you do, there's a corresponding benefit. The more you change, the more you improve and the better you feel. But if you indulge yourself one day, it doesn't mean you cheated or you're bad. Just eat healthier the next. You don't have time to exercise one day, do a little more the next. And even more than being healthy, people want to feel free and in control. And this goes back to the first dietary intervention when God said, don't eat the apple, and that didn't go so well, and that was God talking. So try not to tell other people they should be changing. Just be a good example for that. But again, there's no point in giving up something that you enjoy unless you get something back that's better and quickly. And when you make big changes, you feel so much better so quickly, it's worth doing. Medicare is now covering my program for reversing heart disease for the last 11 or 12 years, and we've been training hospitals and clinics around the country, and it's working. We're getting bigger changes in lifestyle, better clinical outcomes, bigger cost savings, and better adherence than anyone's ever shown. And in just a few months ago, Medicare began covering my program when done via Zoom, so we can now do it in the privacy of your own home, anywhere in the country. So if you're interested in learning more about my work, go to ornish.com. We're also working with the National Health Service, with Prince Charles we met with on several occasions, and the Ministers of Health to see whether they'll be covering that as well. Here's just a 1-minute testimonial that Prince Charles did about our work.
I must say, I was fascinated to meet, once again, with Professor Dean Ornish and his wife Anne earlier this year at my home at Highgrove. They are remarkable leaders in lifestyle medicine and have demonstrated that simple lifestyle changes, improving diet and exercise, reducing stress and building relationships, can not only prevent but even reverse the progression of many chronic diseases.
And in closing, what's good for you is good for the planet. What's personally sustainable is globally sustainable. When you make these lifestyle changes, you free up resources to feed the hungry. It takes 14 times more resources to make a pound of meat-based protein than plant-based protein. More global warming is caused by livestock consumption than all forms of transportation combined. We can reduce health costs in half in the first year when people begin making these changes. And it's so easy to say, like, what can I do as one person to make a difference? Well, this is something you can do, and that really empowers us and makes our lifestyle choices meaningful. And if they're meaningful, they're sustainable. So thank you so much for the chance to be here today. Thank you, Tony. Thank you, Peter. Thank you all for the amazing work that you're doing. I'm just honored to be part of it. Thank you.
Give a big hand to Dr. Dean Ornish.